Hello everyone, I am Dr. Rajiv Kaushal, pathologist at Tata Memorial Hospital, and I am going to share some experience on the Lung Connect advocacy group about the diagnostic workup in a lung cancer. So when a patient is suspected to have a lung cancer, the diagnosis is confirmed by either a biopsy or FNAC. So there the role of a pathologist come into the picture. So we as a pathologist has to give a confirmation of the malignancy, and in current era it is not only important to say confirm presence or absence of a tumor, but we have to categorize it further because the treatment decisions are taken depending on the type of the tumor. So when a biopsy come to the lab, it is first evaluated for the whether it is a small cell or non-small cell cancer, which are the most common type, and after that some basic immunohistochemistry tests are done on that biopsy to give a precise diagnosis of adenocarcinoma or squamous carcinoma or any other type of tumor. So the journey of a tissue starts from the radiology, and when it comes to the path lab, it undergoes these mandatory tests. So the diagnosis, if it is not done without doing these tests, it can be incomplete and the treatment decisions might not be taken properly. So the story do not end over there. So after a complete diagnosis is offered, the same tissue which is used for the diagnosis also undergo various new other biomarker test or molecular test. So the biopsy sample which is obtained from the patient is very crucial, not only for the diagnosis but for these new advanced biomarker tests. And why they are important? Because based on the results of these molecular tests, patient is offered a targeted therapy. So what is targeted therapy? Means from the lab we tell that in this particular cancer patient, there is an alteration of this particular molecule in the cancer, and a specific type of drug is offered to the patient which has very less side effect as compared to the conventional chemotherapy drugs. So in current era, the role of a pathologist is very crucial, and we hold the center stage in the diagnosis and management of the cancer, because type of therapy is decided based on that biopsy tissue, which is first handled for the diagnosis and then for the molecular testing. So if any clinician ask a patient to undergo a biopsy, the patient has to be prepared, because his whole treatment is based on that, and there are very safe methods nowadays to obtain a biopsy. So don't get scared by giving a tissue for the biopsy. It is for your benefit as a patient and for the clinician to decide your treatment. So another thing which I would like to emphasize is about the support group, and Lung Connect is one of them, because many patients when they come to the OPD, they are not very well prepared to undergo these type of procedures, and they have so many doubts in their mind, and this platform gives us the opportunity for the patients to clarify their doubts before taking the treatment decisions, and they also help to provide the information about the cost, the long term outcomes of this. So this is a very good platform which is essential for many patients, especially in India, where the information is not readily available, and sometimes even doctors in the OPDs don't have so much time to clear each and every doubt of the patients. So this is a very good initiative, and each and every patient of lung cancer should take maximum benefit out of it. So with this I end my thoughts about the role of a pathologist on the cancer management.